All right, thanks so much everyone for joining us, and I expect that there'll be some others who will be arriving as we get started. But I just want to introduce myself. I'm Jessica Lukens, and I serve as the Managing Director at the Focused Ultrasound Foundation. Thank you for tuning into our update about NaviFUS and its important impact on the focused ultrasound field. You will hear from Dr. Lung, CEO of NaviFUS, and two clinicians who are using NaviFUS devices to treat glioblastoma, which is a devastating form of brain cancer, and epilepsy, Dr. Wei and Dr. Yu. After their presentations, there will be a question and answer session, so please feel free to pose any questions at that time. Or you may add questions to the chat as you think of them, and they will be addressed during the Q&A session. And now, to start things off, Foundation Chairman Neil Cassell will share some brief remarks.
Hello, I'm Neil Cassell, the founder and chairman of the Focused Ultrasound Foundation. Focused ultrasound is a rapidly evolving, totally non-invasive alternative to traditional surgery and radiation therapy, a new way of delivering drugs more safely and effectively, and of enhancing cancer immunotherapy. As such, it has the potential to transform the treatment of a wide variety of serious medical disorders and thereby improve the lives of millions of patients around the world. Every month that this revolutionary technology is not available translates into unnecessary death and disability and suffering for countless people. The Focused Ultrasound Foundation is a unique, high-impact, high-performance medical research, education, and advocacy organization that was created to shorten the time from laboratory research to widespread utilization. The foundation operates catalytically to accelerate the development and adoption of focused ultrasound, saving time, saving lives. The foundation is based in Charlottesville, Virginia, but has a global impact with sister foundations in Hong Kong and in London. Currently, there are 69 manufacturers of focused ultrasound equipment that we have been tracking. We continue to be impressed by NaviFUS and their state-of-the-art leading-edge technology. We have enormous respect and appreciation for the skill and experience of their outstanding team. The foundation is committed to funding research using NaviFUS equipment, but more importantly, we're committed to ensuring the commercial success of NaviFUS as it expands from Taiwan to the rest of Asia, the United States, and Europe. The most visible and impactful application of focused ultrasound is for brain disorders like Alzheimer's and Parkinson's disease, epilepsy and brain tumors, OCD, and depression. Success in the brain will drive success in other parts of the body, including treating and managing benign and malignant tumors of the lung, breast, pancreas, liver, and prostate. The NaviFUS technology will allow democratization of the brain treatments throughout the world, increasing the accessibility and utilization of focused ultrasound technology, and at the same time, decreasing cost. NaviFUS is key for the foundation to achieve our vision of focused ultrasound, improving the lives of millions of people around the world. We will now hear from Dr. Arthur Lung, CEO of NaviFUS, followed by Dr. Wei from CGM Hospital in Taiwan, and finally Dr. Yu from Taipei Veterans General Hospital.
Hello, ladies and gentlemen. This is Arthur Lung, the CEO of NaviFUS Corporation. It's my pleasure to join this virtual meeting today. I'll give you a brief introduction about innovative technology and its origins, which has been developed for over 20 years ago. I will also briefly describe how this technology can bring benefits to patients who suffer from the central neural diseases, like the brain tumor, epilepsy, and Alzheimer's disease. To start up, let's look at some of the current unmet needs in CNS disease. And take, for example, the deadliest kind of the brain tumor, we call it glioblastoma multiforme, the GBM. And from this picture, you can see, and 60% of the patients will die within 18 months after being confirmed with the disease. The 5-year survival rate is only 70%, no matter how many therapies they have received currently. And there are no good drugs that can penetrate the blood-brain barrier, we call it BBB, to kill the tumor cells in the brain. To make matters more complicated, these killed tumors can often reoccur in different sizes at a different time later. Thus, given the deadly nature of disease and the difficulty in the treatment, it is really a tragic and unresolved challenge that neurosurgeons ever faced before. However, the technology that we have been developed by the NaviFUS can help to solve these challenges. We can use a transcranial focused ultrasound energy. We can briefly and temporarily open the blood-brain barrier to enhance the drug treatment efficacy, and our clinical data shows that this can extend the patient's survival time for over 6 months. And another clinical unmet need in CNS disease, and one that has been getting a lot of attention recently, is Alzheimer's disease. Alzheimer's disease is a common cause of dementia and the 5th leading cause in adults older than 65 years old. And currently, only 2 drugs get approval by the FDA, and 1 has yet to get insurance coverage. It is unfortunate that after years of research and drug development, treatment options for Alzheimer's disease remain limited. However, this only emphasizes how difficult the disease is to treat and how more clinical data is needed to support drug development. It also highlights that the needs of this new technology that can treat the difficult to reach and dedicated regions of the brain. The transcranial focused ultrasound fulfills this requirement, and in our preclinical studies, we have discovered that we can open the blood-brain barrier and increase the occurrence of the beta amyloid deposit, which will also induce some neurogenesis effect, all of which can potentially help to improve the memory recovery. We hope to translate it into clinical studies soon. And the third example of the clinical unmet need in CNS disease is epilepsy. And you know, almost 1/3 of the epilepsy patients are drug resistant. And currently, some minimal surgeries or implantable electrical medical devices can help to reduce the seizure syndrome of these patients. However, the penetration rate is low. Why? Because all these treatments are invasive, and some of them are irreversible, and some require battery to adjust them. They also entail the high risk of infection, anesthetic allergy, or other damage to your brain tissue during the surgery. Whether there is a totally non-invasive solution that could decrease the seizure syndrome for these patients, that's the challenge that we are trying to solve. And currently, from our preclinical data, we found that use the focused ultrasound that can help to reduce the seizure symptoms through the neuromodulation of abnormal neurons in drug-resistant epilepsy patients. Now, and let me introduce the focused ultrasound technology that we have been developing. Most of you may be familiar with the ultrasound already, and some of you may have used it before to check your baby or your heart and liver during a normal health check procedure. But if you want to use this ultrasound energy to do focused ultrasound therapy, you will need to overcome several critical barriers. The first one is that you need to fine-tune the vibration frequency to be less than 1 megahertz. Then you can deliver energy into the brain. And the second, because most of the energy will be resolved by the skull bone, you need your focused ultrasound energy be focused to one small spot. So it can open the blood-brain barrier, but cannot harm other soft tissue in its passing route. And the last one is that this focal energy should be large enough and precise enough to target the right spot in your deep brain regions. So we designed a special 256 phase array transducers that can generate focused ultrasound to one small spot, only 3 millimeters in diameter. And this energy of this small spot can generate enough power to open the blood-brain barrier. And it can also control the power based on each patient's characteristics, so it won't overheating surrounding tissues. So combined with our software, which we used to plan the treatments before, we could easily to power steering these focal beams from one spot to 43 spots in less than 1 second. So we can tailor the treatment site from 3 millimeter to a 2 centimeter spot to treat this CNS disease in the brain. And the next important principle in using the focused ultrasound for the treatment is how to guide the ultrasound. Because if you cannot see the ultrasound energy, how do you know where and when you can deliver it into the right anatomic site in the brain? So we have the global pattern for an innovative way to use a neural navigator to guide the ultrasound in focal beams in your brain. The advantages to use this guiding system are that we do not need to go to an operation room and take an intraoperative MRI while doing the treatment. And we also do not need to add an external head fixator frame on the patient's head. So the patient can relax in the chair to receive the therapies and done the therapy within 30 minutes. Now I will use 2 videos to show you the basic mechanism of opening the BBB and performing the treatment in outpatient clinics using our devices. After the video, you can really see our technology is really easily and friendly to the patients. Maybe you were wondering when this technology was developed and why you may never heard it before. And this is the history of focused ultrasound that has been in development for over 20 years ago. We can find that the first paper determining the FUS-mediated BBB opening was published in 2001. But only until 2016 did the first clinical trial, human clinical trial, using ultrasound to open the BBB start, which was kicked off by a company called Cathedral. And in 2017, another company did a preclinical study for the Alzheimer's disease and clinical studies as well. And for the NaviFUS, we kick off our clinical trials with the treatment of brain tumor. We use the focused ultrasound and BBB opening technology to deliver drugs. And we are also the first company to do the focused ultrasound neuromodulation trial with epilepsy patients. And from this slide, we can summarize our benefits. It's a patient-friendly software and hardware, and it's precisely guided by the neural navigator. And our software and the dual train the mode to receive the signals can safely and non-invasively do the treatments. And currently, we're focusing on the following indications: the recurrent GBM and Alzheimer's disease and epilepsy. And our paper clinical data was published in these top journals like Science Advance and ATVM, and epilepsy. And here's our pipelines for the clinical studies all around the world. We have done several phase 2 clinical studies, and now we try to move to the phase 3 clinical studies. And we promise that we will invest more clinical studies to develop these novel therapies for the unmet needs of CNS-related disorders. And we also start our clinical studies in Taiwan, now expanded to world, like the Stanford University, University of Virginia, and the Monash Hospital in Australia. Finally, you can see that the NaviFUS is a small startup company established in March 2015, and we received continuous attention from the Focus Ultrasound Foundation, and we were greatly thankful for the foundation's support of this company. And our clinical data was published in top peer-reviewed journals with high impact factors. And in the past 8 years, we have won many awards in both Taiwan and the USA. We are the gold medal winner of the Edison Award in outpatient clinics field in 2022. We wish we could soon get more clinical data and license approvals in different countries to serve more patients with this innovative technology. Thanks for listening to my presentation today. And if you have any additional questions or inquiries, feel free to contact us at our website.
This is Kuo-Chen Wei from Chang Memorial Hospital in Taiwan. My talk is brain tumor treatment by focused ultrasound that induce blood-brain barrier opening. And this is the outline, including the blood-brain barrier overview and focused ultrasound introduction, and also the clinical trial setting. I'm a neurosurgeon, practiced at Chang Memorial Hospital, Linkou Medical Center in Taiwan. My research interests including the neuro-oncology and awake craniotomy, and biosignature of brain tumor, central nervous system drug delivery system with focused ultrasound and nanotechnology, neuromodulation by focused ultrasound. And the glioblastoma is the most common and most aggressive form of primary brain cancer. Every year, more than 241,000 people die from this disease, and the 5-year survival around 4.7%. Almost 100% of the patient will recurrence. And the glioblastoma treatment alternatives, including the surgery, radiation therapy, chemotherapy, target therapy, and immunotherapy. Although these many treatment alternatives, the patients still suffer from brain tumor. And the blood-brain barrier is a special structure in the brain that composes 2 layers of blood vessel. It will protect the brain against the toxic substance damage to the brain, but it also decreases the concentration of drug into the brain that will always influence the treatment of brain disease. So the blood-brain barrier always the major issue of brain tumor treatment. The focused ultrasound offers a game-changing alternative to echo clinical challenge. Since 2008, I collaborate with Dr. Hao-Li Liu. We study the focused ultrasound and the brain tumor. We complete many preclinical studies and also the phase 1 and phase 2 clinical trial, including the focused ultrasound BBB open enhanced temozolomide delivery and neural navigation guide focused ultrasound BBB opening, and 256 channel dual frequency ultrasound phase array system, and also the focused ultrasound induced BBB open enhanced bevacizumab delivery. After 2015, the NaviFUS Corporation set up. Then in 2019, we finished a phase 1 clinical trial. And since 2020, we're going on a phase 2 trial to test the safety and feasibility of NaviFUS in recurrent glioblastoma. The most important technology of the focused ultrasound to induce blood-brain barrier open is how to deliver the ultrasound energy through the thick human skull. Dr. Holly Liu developed a phase array transducer to overcome this issue. And the second issue is how to target on specific region precisely in the large brain volume. My team developed a neural navigation system to complete this issue. So combine above two technologies, the focused ultrasound could open the window for more effective treatment at target location in brain tumor. This is the simple diagram of patient setting of NaviFUS system. Patient can sit on the chair or lie down on a bed, had simple fixation. The doctor hold the focused ultrasound transducer that labeled with optoreceptor. Under the navigation guide, the focused ultrasound will target to the treatment region to perform the treatment. Take the advantage of NaviFUS system. We complete a phase 1 clinical trial in 2019. The result we published in the Science Advance. The evidence from our clinical trial show blood-brain barrier opening is safely, and the second blood-brain barrier recovered after focused ultrasound treatment within 24 hours. And based on the result of phase 1 study, we kick off phase 2 trial in Chang Memorial Hospital in Taiwan, 2020. We enroll the recurrent glioblastoma patient combined with the focused ultrasound and Avastin to enhance blood-brain barrier opening. We will observe the safety and also the patient progression-free survival. The Stanford University also joined the phase 2 trial in 2022. This is the clinical trial in Chang Memorial Hospital. The focused ultrasound BBB open is an outpatient procedure. The standard treatment duration around 15 minutes. The preliminary result of the focused ultrasound treatment. Until November 2022, the progression-free of the focused ultrasound treatment. Compared with historical result, the 6 months progression-free survival was 42.6%. The median progression-free survival was 4.2 months. the median overall survival time was 9.2 months. The progression-free survival after focused ultrasound is 9.5 months. And the overall survival after focused ultrasound did not reach. This is very promising result. And I will talk about a little future opportunity of focused ultrasound in brain tumor treatment, because the major challenge in the treatment of glioblastoma is blood-brain barrier issue, drug-resistant issue, hypoxia, glioblastoma, stem cell, and intertumoral and intratumoral heterogeneity. Those issues we can convert and we can resolve by BBB open. Except for this BBB open, we can take the advantage of therapeutic focused ultrasound to perform some sonodynamic ablation, radiosensitization, immunomodulation, and liquid biopsy to improve the efficacy of brain tumor treatment. And lastly, I will thank the member from Chang Memorial Hospital brain tumor team and the member from the Translational Brain Tumor Lab that did by me, and the member from Therapeutic Ultrasound Lab that did by Howley Liu. Thank you.
Good evening, ladies and gentlemen. I'm Hsiang-Yu Yu. I'm glad to be here today to introduce a novel treatment for epilepsy and share the clinical trial experience by using this new system. And this is the outline of my talk today. And I'm now the section chief of epilepsy section in Taipei Veterans General Hospital, an associated professor in National Yangming Jiaotong University. I'm also the president of Taiwan Epilepsy Society. My clinical expertise and research interests are epilepsy treatment, epilepsy surgery, intracranial EEG recording, neuromodulation, women with epilepsy, and psychosocial aspect in epilepsy. And here I would like to talk some about our comprehensive epilepsy surgery team. It is the largest epilepsy center in Taiwan, and it's a level 4 according to the definition of National Epilepsy Center Association of United States. And we evaluate more than 200 adult patients with drug-resistant epilepsy every year, and more than 80 cases every year undergo surgical intervention. And this is the milestone of our team. We have our first anterior temporal lobectomy in 1987. In the past 30 years, we introduced new technique and surgical procedures to improve the surgery outcomes. And let's talk some fact about epilepsy. It is a neurological disorder and caused by disruption of the electrical activity in the brain. And more than 50 million people around the world having epilepsy. And among them, more than half of them, we don't know exactly the cause of epilepsy. Fortunately, more than 70% of them, their seizure could be controlled by 1 or 2 anti-seizure medications. However, they do have a higher risk of premature death, 3 times higher compared to general population. As the previous slide, we know that 30% of the patient, their seizure could not be controlled by 1 or 2 anti-seizure medication. And this is the definition of drug-resistant epilepsy. In this situation, we can try to seek for surgery. It is a very useful method to cure epilepsy. And in the old ages, we need a very huge craniotomy to remove the epileptogenic brain tissue. And in the past 20 years, the minimally invasive surgery became a trend. For example, selective hippocampectomy, functional disconnection, and laser institutional ablation, and radiofrequency thermal ablation. And if the patient is not suitable for a resective surgery, we can try neuromodulation, and it is less invasive, but we need to implant the device into the body. The approved treatments for neuromodulation are vagus nerve stimulation, deep brain stimulation, or RNS. We need to have a surgery to implant the device into the body, and there will be increased risk of device related adverse effect. So here comes the new method that we are going to talk today is focused ultrasound. It is non-invasive, and we don't have to implant any device into our body. It could be a new solution for treatment of people with epilepsy. And I will talk some about our journey to use this new modality to treat epilepsy. In 2017, this is the first time we contact with NaviFUS system. And at that time, there are already some solid evidence from animals or normal human being that focused ultrasound can modulate the central nervous system. After talking with Dr. Long and Professor Liu, we all believe that focused ultrasound is a potential treatment for people with epilepsy. So we started our first animal studies using the PTZ model to prove that focused ultrasound position can be suppressed. The epilepsy activity, and it was completed in 2019. We come to our first pilot study of focused ultrasound for people with epilepsy. And at the same time, we try to demonstrate the maintenance periods of the focused ultrasound neuromodulation. We use the KA animal models. After we finish our first pilot study of human epilepsy, and we immediately go into the second trial, a pilot single-blind crossover study to investigate the safety and efficacy of the NaviFUS system. And we are also working on several proposals and to try to find a better solution to prove that the focused ultrasound is a useful tool for treatment of epilepsy. And how focused ultrasound could reduce the abnormal electrical activity in the brain. We have to know that there are thermosensitive and mechanosensitive channels in the cell membrane of a neuron. This is a key point, and let's see this video. So when the focused ultrasound delivered to the cell and the membrane conformation changed, also the permeability of the ion channel. In this way, the abnormal electric activity can be reduced by focused ultrasound. Here, I want to introduce how we did the treatments in our phase 1 clinical trial. We need an MRI and a CAT scan before the treatments. We make a plan, simulate the situation. We are going to do the treatments. We have to calculate the bone density and the energy penetrated to the targets. On the day of treatment, the patient have to shave the hair, and the neurosurgeon will hold the transducer and adjust the position and angles by the guidance of a navigation system. All this procedure can be done at outpatient clinical setting, and the whole treatment lasted 1 hour, including setting up the machine. And this is the flow chart of our phase 1 clinical trial. After we got enough information in the intracranial EEG recording, we simulate the treatments. And on the day of treatment, we deliver 10 minutes sonication to the target area, and which were followed by 72 hours intracranial EEG monitoring and the clinical manifestations. After the electrode were removed, we arranged an MRI to show that there is no evidence of lesioning effect before the treatment and after the treatment. And we have one patient who underwent resection 2 months after the clinical trial. Microscopically, we didn't see any bleeding or tissue destruction. And the intracranial EEG is a good tool to monitor the intervention effect. And here is the electric activity from the target electrode and the non-target electrode in the same patient. We calculate and analyze the signals 10 minutes before and during the treatment and 10 minutes after the treatment. Here we can see on the target electrode, the lower frequency power spectrum reduced compared to the baseline, while in the non-target electrodes, there was no significant change. Among the 6 patients, there is a trend of increased power during the treatments and a reduced power after the treatment. So in this phase 1 clinical trial, we demonstrated the safety and the feasibility to use focused ultrasound for drug-resistant epilepsy. And we also demonstrate that the intracranial EEG modulated by the treatments. Here are the photos that we got in our phase 2 clinical trial. And this will be the clinical settings when NaviFUS became a regular clinical treatment. It's quite simple that the plan will import it to the navigation system. The operator adjusts the transducer position according to the navigation system. The patient sitting comfortably in the chair, and during the treatment, the operator can adjust adjust the position and angle according to the pre-planned trajectories. And from these photos, we can get an idea that the merit of using NaviFUS system in the clinical setting. There's no radiation, there's no incision, no sedation, and no need to be constrained in the MRI room, and it's quite space saving. But how about the efficacy? Be honest, we still need more sample cohort and pursuing optimal sonication parameters to prove focused ultrasound a better treatment option for people with epilepsy. And indeed, by using the NaviFUS system, there are 3 epilepsy centers working on the clinical trials simultaneously in Taiwan, United States, and Australia. I believe the data will come out in the near future. And about the future opportunity of the focused ultrasound in neuromodulation, as we know, not only mechanical force, there are also cavitation and heat characters of the focused ultrasound. They can be used for epilepsy in the lesioning on epileptic tissue or drug delivery. And for other neurologic disorder, the neuromodulation effect of focused ultrasound can be used in migraine, depression, movement disorder, Alzheimer's disease, and minimally conscious status. And that's my talk today. Thank you.
Great. Well, thank you to our presenters, and thank you all for your attention during the presentations. We will now open up the question and answer session. If you have any questions for our presenters, please feel free to come off mute and ask them at this time. I guess one question that I have for Dr. Wei and Dr. Yu is just kind of speaking about the patients and, you've gone through kind of their experience in treatment, but afterward, what were their thoughts? Were they, pleased, satisfied with the experience? Just kind of any anecdotes that you can share with us. Oh, and we'll need NaviFUS to come off mute. Oh. There we go.
Yeah. Hello, this is Kuo-Chen Wei. According to my preclinical study and clinical trial, I'm sure the ultrasound, focused ultrasound via the NaviFUS is very safety because we've gone through many patients. They can very comfortable go through all the procedure. And the phase 2 clinical trial, the preliminary data from the enhanced the permeability is quite effective. But we want to know the real endpoint is overall survival, but because the time is not reached, so the overall survival I did not show, but progression-free survival from this 6 patients is very good compared with the traditional data. So until now, I'm very satisfied for the NaviFUS assist the drug delivery.
Yeah, for patient with epilepsy, it's not like brain tumor, so life-threatening. And if the patient is encouraged to undergo any invasive study, it's quite optional. Yeah, it's a functional disorder. So in our phase 1 and phase 2 trial, I noticed that those patients are very reluctant to any invasive procedures for their brain. So when they heard this new treatments, they agreed to join this trial. And among the 12 patients we have treated, among them 2 asked me if they can join that treatment again. Because they are satisfied with the procedures. Is quite clear. Patient is very clear through the treatments, and there is no incision. They didn't feel any pain. So about the safety and side effect, they are very satisfied. but the efficacy, we need more cases to prove that. That's my experience about the patient's feedback so far.
Great. Thank you, Dr. Wei. Thank you, Dr. Yu. If there are any more questions, please feel free to chime in now. All right. Well, this was very informative. Thank you all for joining us. A very special thanks to Dr. Lung, Dr. Wei, and Dr. Yu for preparing their remarks and sharing them during this update. We are really excited to spotlight their innovation and the difference that they are making in patients' lives. As we mentioned, this update has been recorded and we will circulate the final recording to attendees, and this will also be promoted through the Foundation's newsletter as well as be posted on our website. So when it's available, we encourage you to share the recording link with any contacts within your networks who may be interested in learning more. And to learn more about NaviFUS, please visit navifus.com. For more information about focused ultrasound, please visit fusfoundation.org. And also check out fushk.org, which is the website for the Focused Ultrasound Hong Kong Foundation. Thank you all and take care.
Well, thank you.
Thank you.